All right. Well, hello everyone, and welcome back to EllieMD's live educational series. I am Honey Sagari, founder and CEO of EllieMD, and I'm joined by my co-host Lauren Nashir today to talk to you all about melanotan. At EllieMD, community and education are at the heart of everything we do. We don't just offer great access to cutting-edge peptides and therapeutics. We want you to understand them, feel confident in them, and receive the support that you need by a community that's on the same journey towards better health and longevity. Today, we're excited to bring you a conversation around one of the most talked about peptides in the space right now, melanotan 2. While many people associate it with tanning, the science behind it goes much deeper, involving melanocortin pathways that influence pigmentation, metabolism, and even neurochemical signaling, including libido. To help us unpack the science and what this means for your health, we're joined by Dr. Willie Villarreal. Dr. Willie is a doctor of nursing practice and co-founder of Core Health and Wellness. With over 23 years of experience in surgery, his background spans in cardiovascular and robotic surgery, where he's worked at the forefront of advancing modern surgical techniques. His clinical work has evolved into strong focus on metabolic health, where he's helped patients reverse metabolic syndrome and type 2 diabetes through innovative research-backed approaches. Dr. Willie, what a pleasure to have you here. Thank you.
Hey, how are you? Thanks for having me again.
Wonderful. Thank you, thank you, thank you so much. We love what you share and the trainings that you have. You just break down the science in layman's terms for everyone to understand. So really appreciate you being part of our community. Um, Before we get started, maybe give us a little background on yourself. Talk to us about what piqued your interest with peptides and what your journey looked like overall.
Sure. I'm into obviously longevity, health, and wellness, and really focus on health span, right? Expanding the length of time, not just making you live longer, but making you live longer healthier, right? That's kind of the focus of our clinic. So early on, I saw kind of the benefits of peptides. They were a lot harder to source at that time. But the research has been really solid on a lot of them. And so I personally saw the benefit early on from my athletic background, but also from a health and wellness background. So as always, I always test things on myself, right? And I always look at everything as a risk benefit ratio. If it has high benefit, low to no risk, I'm all for it. And peptides really fit that bill because there's really just amino acids and for the most part have little to no side effects except in like extremely sensitive people. And the worst it can have is really like flushing, some nausea with some of them, but those are with really sensitive people. But yeah, so I've kind of implemented them into practice years ago. But again, like we've discussed, I specialize in hormone therapy and metabolic health. So, I want to make sure they're having a proper diet, nutrition, eating well, active, my initial consults run about an hour. So I get to, learn everything about the patient, their previous medical history, and then get to everything rather than, your typical 5 to 10 minute office visit where I have to speed through, getting through a diagnosis so I know what drug to throw at the patient. I have the kind of unique ability to kind of help them from a lifestyle change standpoint, but also prescribe medications and supplements and peptides if I need to.
Love
So
that. Thank you for serving the community, and it's much needed for taking that personalized one-on-one approach. That's beautiful. Thank you. All right, let's get started and talk about melanotan. Tell us everything. What is it and where did it come from and why are people in health and wellness space talking about it? Why is everyone so excited about melanotan too?
well, so melanotan is just strictly another peptide. It originated from alpha MSH or alpha melanocyte stimulating hormone, which is a naturally occurring hormone in our body. Researchers initially became interested in it because of its ability to stimulate melanin production and potentially help protect the skin from UV damage, so that's the initial foray into what it was. So over time they kind of realized the melanocortin system influences a lot more than just tanning. So it affects appetite. Like you mentioned, it affects appetite, inflammation, metabolism, libido, immune signaling, and even mood. So that's why kind of the longevity and wellness space have become increasingly interested in it.
Mm.
That's really amazing. Can you talk a little bit about the melanocortin receptors? And I know there's some different types. So what are they linked to? What do they do?
So there's really MC, they're called MC1 through 5, right? And so they exist throughout the body. So they all do different things. So MC1 is heavily involved with the skin pigmentation and melanin production. Okay. Whereas the MC3 and 4, they're going to be, more involved with appetite, metabolism, energy regulation in the brain. MC4 receptors also influence sexual behavior and autonomic nervous signaling. So understand, everybody's had seen PT141 for a long time. Well, that's bremelanotide, and that's been FDA approved under the name by Lisi for a long time. Well, bremelanotide is a melanotan derivative. Now, and it's strictly like MC4 that it stimulates, but other melanocortin receptors are involved with inflammation, immune modulation, and they're still learning a lot more about these pathways. So melanotan has little relatively clinically relevant like MC2 activity. So it's mainly MC1, MC3, and 4. But because these receptors are distributed across multiple systems, they activate, activating them actually creates effects way beyond skin color alone. So it's really, you can consider it just like a neuroimmune metabolic signaling network. So it affects a lot of different networks, pathways.
Okay, so just to consolidate the information, three benefits that ultimately you'll receive. You'll receive a tan,
Mhm.
uh, better libido, and also, I
Yeah,
think,
so
appetite.
so it has an appetite suppression effect, libido enhancement, I will say this, spontaneous erections for men, also sensitivity in women. So I will tell you, um, from a lot of patient reports, and we've used it personally also. Um, any guy that's been a teenager or 18-year-old that would get spontaneous erections, I mean, that's what you actually see with melanotan. And sometimes at the most inconvenient times. So, but they have, energy effects. There's a like broader there's a whole bunch. There's a broader neurological responses, but the three main ones you're going to see, obviously the skin. You're going to see appetite suppression, not to the point of GLP-1s, and I'll kind of make that distinction in a minute. But libido enhancement and also erections, because again, it's a melanotan. It's PT141 like is a melanotan derivative. So it hits a lot of the same receptors that PT141 does,
Can you
but
talk
I
about,
broader,
see,
but broader,
I
but
see
broader.
Dr. Angela wrote, you had my husband at spontaneous. There you go.
Yes, and that's one of the best ones. Now, we'll say one of the things that I do like and have seen with MT2 over the years is that there's a lot less of the nausea. I'm one of the ones, I think PT141 works amazing. I'm one of the guys that gets nauseous with it, even at a very low dose with PT141, but I don't get that with MT2.
Mm.
And so there's a lot less of because it hits so many receptors, there's a lot less of the nausea or even flushing with it. So,
So if there's a lot of people talking about M1, M2, melanotan 1 and 2. Can you
yeah,
distinguish the two and
yeah.
what are the differences and what are the pros, cons, benefits of each one?
Yeah, so melanotan 1 is more selective to the MC1 receptor. Okay, so that's the one that's primarily associated with pigmentation, UV protection. It's a lot weaker also, it's not as strong. So like melanotan 1 was actually FDA approved for a long, it was FDA approved a long time ago. It's under the name afamelanotide, or the brand name is Sines. And it was actually, it's given as a dissolvable implant, almost like BioT pellets, but it's a dissolvable implant and they would get it every 2 months. But it's for a rare inherited genetic disorder called erythropoietic protoporphyria. And people with that rare genetic disorder, they get extreme sensitivity of the skin to sunlight. They burn really easily. It causes a lot of pain, redness, swelling in any of the exposed skin areas. And they usually see that, like it's usually seen in childhood or found in childhood or like early childhood or infancy or early childhood. Melanotan II is actually less selective and activates more of the melanocortin receptors, especially MC3 and 4, which is why you get the broader activity. You get the appetite suppression with MC3 and 4. You get the libido, you get the erections, energy, and kind of the broader neuro responses. So that's the main difference. It's just that clinically that distinction matters because melanotan 2 tends to have a more systemic effect rather than MT1 hits only, the MC1 receptor. So that's
I'm impressed that you were able to pronounce that.
Erythropoietic.
erythropoietic protoporphyria.
Yeah. I'm impressed you remembered it and you can pronounce it.
Yeah.
Dr.
Lauren, go ahead.
Yeah, I'm curious because PT141 is more selective for that MC4 receptor. Would the libido effects be stronger than melanotan 2?
I'm sorry, say that again.
Would someone taking PT141 have a stronger libido response than if they were taking MT2?
I think it's very specific to the individual. Because I've seen sometimes more libido and erectile benefits with MT2 over PT141. So I think it depends on the person, and I think it depends on their, like, just like with anything, genetics. That's why when we give somebody hormones, somebody is like super sensitive to androgen, and it might be a low dose, and another person needs a much higher dose of an androgen, and they don't even feel the effect. So I think it's very specific to the person.
Yeah.
I'm getting a lot of questions about, sorry, Lauren, this is what happens when you're co-hosting and you're not to each other. We're getting a lot of questions about the nausea effect of it. A lot of people have really bad nausea when it comes to PT141, or maybe they've tried M1 or so. Let's go over and highlight the side effects that you can expect with M2, and is it worse? Is it better? I know you were sharing your experience before the call with nausea, so maybe you could talk.
Yeah, I get a lot less nausea with it. I have to be real careful. I'm super sensitive to MT2. Like, I used it a few years ago and I got super dark in about like 3 or 4 days. And then I just went on maintenance. I kind of backed off a little bit. And then for maintenance, I would only use it once or twice a week and I could maintain, the color. But the sexual benefits were beyond the color, the sexual benefits were way better. But personally, I just think what I've seen with patients is that MT2 tends to have less of the nausea effect than PT141. I think just PT141 is just more selective and has a stronger response, which is why a lot of people get more nausea with it. And you can mitigate that, like you can lower the dose. You can make sure sometimes you have a good meal right before you take it, and that can blunt it sometimes. There's certain people do certain little hacks. But yeah, the nausea thing is very real with some people. And again, not with everybody. I have people that love it and never experience nausea. But the people that are hypersensitive, they can get some nausea. Not so much with MT2. That's just what I've seen clinically.
So would low and slow work?
Yes.
Yeah.
I am always a benefit, whether it's hormones or Medicaid. Everything is the best dose is the lowest effective dose. The
Okay.
dose where it works and you don't have any issues with it.
Lauren, what's the milligram per milliliter, just so Dr. Willie knows right now?
Yeah, the strength is 2 milligram per milliliter, and each dose is 200 micrograms.
So would you recommend that they split that for their first dose to?
Yeah, I would lower it. I mean, I would lower it just to see, because you can always increase. It's hard to decrease. So I would always err on the side of less.
Okay.
So yeah, I would err on the side of less just to start, maybe even the first 2 injections and then ramp it up, but you'll see pretty quick effects with MT2. So that's another thing versus MT1. MT1, the difference also with MT1 is that a lot of times they have to use that in conjunction with UV exposure, which, what is the ideal amount of UV exposure? So they have to have a lot more UV exposure to have the MT1 work versus MT2. MT2 will color you without you even stepping outside. I mean, your melanin will increase. So and I see that as one of the benefits, like we talked about earlier. I want to make sure that people know, like, it's not a vanity. I used to call it the Barbie injection or the Barbie and Ken doll injection. and it was really popular a few years back, but a lot of people thought it was just for vanity, but it has like I said, a lot broader, mechanism of action. So yeah, I mean, and also it allows you to get by with a lot less UV exposure. So in my book, that's a win because you don't have to get exposed to as much tanning bed, and that's also where, like we were talking about, a lot of the case reports on it, and where the information comes about, hey, be careful with MT2, because there's a lot of speculation that it can raise a risk of melanoma, but it has never been proven or shown in isolation.
Can you talk a little more about that, right? We're stimulating melanin production, which melanin can be a protective pigment, but some people do experience darkening of freckles or their
Yep.
moles, and how
Yep.
common is that, and how do you
Yeah.
advise?
Well, so this is a really important topic, with the sun protection topic and longevity and skin health. And it's one of the most heavily debated, like I was talking about. So melanotan stimulates melanocytes to produce eumelanin. That's EU melanin, okay, which is a darker, more protective form of melanin. So eumelanin acts like a biologic UV shield by helping absorb and dissipate UV radiation before it damages our DNA, that's what causes skin cancer. It's overexposure. It's a radiation burn. It's not the sun. It's overexposure. So because of this, higher levels of eumelanin are associated with lower risk of UV related skin cancers, because it acts like a natural photoprotective shield. So this is why people with naturally darker skin tones have low rates of basal cell carcinoma, squamous cell carcinoma, and lower overall UV related like skin cancers. Here's an important nuance. So higher melanin does not mean immunity from skin cancer. Okay, I don't want people to think that, oh, I'm going to get darker, I can just go out in the sun more. People with darker skin can still develop melanoma, non-melanoma cancers, and what we call acrolentiginous melanoma. And those are the lentiginous melanomas are the ones that are in the hands, feet, nail beds, like non-sun exposed areas. So I never want anybody to think that, it's uh, instead of, right? So higher eumelanin, they're associated with overall with like lower UV damage and lower rates of skin cancer. But I want to make sure people understand this. According to all the studies, they've done a systematic review where a meta-analysis where they look at a lot of different studies, and they found no conclusive evidence that melanotan 2 itself causes melanoma. Okay. A lot of those are what dermatologists, doctors, and all of it's theoretical, and they'll point to those reviews and they said, oh, well, and theoretically it sounds sound, but the problem is that if you look at all those case reports, and if you look at any of the systematic reviews, they all had confounding variables. They were all using tanning beds very heavily. They were all like laying out, sunbathing a lot, and then they would get melanoma. And oh, by the way, they would also happen to have just used MT2. So then they're like, oh, it was the MT2. I'm like, oh, what about all the sun exposure? So sun exposure or overexposure, that's a risk for melanoma itself. So there's never been any specific studies that show MT2 causes melanoma or increases a risk in isolation. Okay. So, but it should never ever replace clean, safe, I mean, and clean, I stress clean sunscreen, because a lot of them are really, really bad for you. And it does not make somebody immune to skin damage. Okay, the increased melanin production. It can provide an additional layer of photoprotection, and it can reduce the susceptibility to sunburn in some people. But I never want people to use it instead of.
You said you mentioned you don't have to go outside. I mean, you'll still get a tan from using,
Yes.
but going outside and getting 10 minutes of UV
Oh,
exposure,
absolutely.
would that make it more effective?
Yes, it will. A lot of the studies show that like you get a little bit of UV exposure, it'll actually stimulate it a little bit more. I'll tell you from my perspective, when I used it, it was wintertime, and I used it for 5 days, and I was dark in 5 days. But like with me, I had a lot of moles, so it made my moles also kind of. And you could always see them. I had moles, but they just kind of make them darker because the melanin's darker. So, and in some cases, you can actually make the case for, like I saw moles that I didn't see before, and that could actually trigger you to go, oh, that one doesn't look right, and go to the dermatologist. So It's not that I never saw it. It's just that now because I'm darker, and that could have happened without an MT2. That could have happened if I had just gone on vacation and laid out for 5 days. So, but for me, I got little to no sun exposure and I got dark in 5 days, really, really dark.
Now, as your tan begins to fade.
Yeah.
Will the moles and the dark spots begin to fade as well?
Yes. Yep.
Okay, so it
Yep.
won't permanently keep them dark.
No.
Yeah.
Yeah, no, they go away. They just as your melanin drops, so do your mole, the color of your moles drop. The darkness of the moles, they also drop.
We got kind of an interesting question too. People were wondering about scarring because some people may have hyperpigmented scars, or have you ever noticed anything in patients?
No, I haven't. I've seen some people, like some case reports of people saying that they got like like they had like odd pigmentation areas and uneven blotching and stuff like that. I've never seen that personally in clinical practice. I'm sure it can happen, but again, that's an individual it's an individual response.
And how about hormone-related hyperpigmentation? Will this make it worse?
I have not seen it. In fact, and I've seen it actually help some melasma. It didn't make the melasma for some people. It didn't make it worse. And for some, but I will say for some people it can. I mean, but again, it's hormone related, right? So like my wife got really bad melasma when she was pregnant, and then after the baby it went away. But I've not seen any women with melasma make it worse. Could it happen? Theoretically, yeah, possibly. I've just not seen it, kind of across the board with everybody. I will say that since it has a full body effect, what I've seen is that you'll actually tan everywhere and kind of evenly. So it's not like you're going to tan more in your arms, you're not going to tan more in your face, tan more. It's like a full body tan because the body's it's increasing melanin throughout the entire body. And so that's where you don't have to go lay naked in a UV bed. I mean, you're to not have, tan lines. It's a full body tan. It's a full body like darkening.
Well, there you go. Say goodbye to tan lines unless you're
Yeah.
into that. Yeah.
Or orange blotchy tanning creams and
Yeah, there's no orange. Like there was some tanning pills that were around, like in the late 90s, early 2000s that were like taken off shelves and they were turning people orange. This is not like that. This is a true dark, almost like if you come back from vacation, or you live in the Caribbean or something. So.
Yeah, I was going to ask, what shade of tan do you get? Do you get the orangey shade?
No, you don't. You do get like a true dark. If you've ever had a tan, and when we were younger, that's what you can expect to look like a darker, not the fake orangey look.
I have a question as it relates to GLP-1s. If someone's already on GLP-1 weight management, how does melanotan's effect on appetite compare or potentially complement what they're already taking? And should they decrease the dose? Is it perfectly fine? They could go well together. Can you talk about those two paired with one another?
Yeah, so it's important to understand how the difference, right? So GLP-1s primarily work through the incretin signaling, which is like gastric emptying, insulin regulation, satiety hormones. Melanotan works through melanocortin signaling pathways in the brain. So while there can be overlap in appetite suppression, they're acting through different mechanisms. So they can be used together. Some people report like complementary effects. A lot of people like both of them. But combining therapies also kind of increases the caution around not so much. I haven't seen more nausea with both of them. If you're going to get there's some people that just like with the GLP-1, they're super, super sensitive even at the low dose with a GLP-1 get nausea. The biggest concern I would have is just with even a GLP-1 is like under eating, muscle loss, nutrient deficiencies, excessive appetite suppression. So I haven't seen people's appetite get over suppressed, but understand that even with GLP-1s, like there's nothing in a GLP-1 that eats muscle. There's nothing in a GLP-1 that makes you lose hair. They come in and say, I took GLP-1, it made me lose my hair. No, you're eating 300 calories a day. Women are notoriously bad about protein intake. Okay, just they are. And so you put them on a GLP-1 and their protein intake drops even further. And then they also underestimate the amount of protein they take in. So like I just had this yesterday. I had a lady, I said, okay, like take me through your diet. What do you eat? She goes, oh, I eat protein with every meal. She was like, okay, let's go through it. So she says, I ate a hard-boiled egg. I'm like, okay, that's like about 6 grams of protein. I said, what else? She's like, well, that's it. And I'm like, okay. By the time we tallied up her daily intake, it was like 40 grams of protein. And she thought she was eating high protein. And so you can see where people that are even intentional, they're not taking in enough protein. So with the GLP-1 and with melanotan 2, you just always want to make sure you're prioritizing protein. You're doing some type of resistance training, for the muscle. But the biggest thing is it's more complementary rather than over suppression of hunger that I've seen. So the goal should never like simply be eat less. It's metabolic health, body composition preservation. So I always promote protein intake, always.
Thank you. Thanks for sharing that. And then I see a question here. Does the use of GHKCU, which also impacts the skin, impact the use of melanotan?
No, not that I've seen, because it works more on collagen, type 1 collagen, elastin, things like that. So it's not really affecting any kind of color when it comes to skin. Even topical GHKCU or anything like that, it's the same thing. It's not going to affect the use of MT2, because again, remember, it's just strictly increasing the melanin. And then again, the other side effects. Again, I do not want people to underestimate the sexual benefits that it provides, because I know everybody, like, the most visible part of it is going to be the tan, but it's one of the most effective for erectile function for men, sexual dysfunction for women. It's super powerful for that, from that pathway.
We have a lot of women in our community, and I know someone asked earlier just about how do women experience this arousal or sensitivity, compared to a man?
Well, so they get more clitoral sensitivity is what they'll see, because especially as you get older, and especially if they're not in their menopause, and if they've had, a lot of women will shift to either anorgasmia, where they can achieve orgasm, or difficulty achieving orgasm. So that's like, we call it HSDD, or hyposexual desire disorder. And so there's tons of medication that have tried. Addy is out there, but like, Addie increases, if you read the study, it increases sexual encounters by like 1 to 2 a month. I mean, that's really nothing. I would say MT2 has a lot stronger effect, but it's more in the sensitivity. But also think about how PT141 works. It doesn't work in like locally, it works in the hypothalamus. So it increases sexual desire for women. So it's going to do the same thing in the women, along with the sensitivity and the blood flow. It's going to help with the arousal in the hypothalamus for women.
May I ask, I mean, these peptides are short-lived. How long can you expect to benefit from this when it comes specifically to sexual dysfunction? Because I've heard reports of people still reaping the benefits days later.
Right.
But how does it affect, I guess, libido for a duration of time, as it relates to duration of time?
Yeah, you'll see a lingering effect for about 3 days post injection. Kind of like with PT141, which is why, like, PT141, you can inject it twice a week, and it covers the whole week. I mean, it lingers beyond the injection. So, and then the longer you use it, I mean, it's almost like retraining the body. Like, the body knows, now it's remembering what to do. And and again, it's not by itself. I mean, you also want to make sure that they have good blood flow, good nitric oxide support, good vasodilation, things like that. But on its own, I mean, it is super, super, super potent for sexual response. And it does linger. It lingers a few days after. And the longer you use it, again, after a maintenance phase that we start with, and that can be anywhere between 3 to 5 to 7 days. For some people, it just depends until what we would usually recommend is you would do it for a few days until you hit your color, your optimal color you want, and then you can maintain it with anywhere from 1 to 3 injections a week. The sweet spot is really like 2 to 3. And then like you were saying, do it for 8 weeks and then take a few weeks off. Even stopping for that month, your color will maintain for a good, 2+ weeks with it.
We may need to come out with an Ellie contraceptive at this point.
Yeah.
With 5 days on, 2 days
Yeah.
off, an entire
Yeah.
month. Oh boy, forget
Yeah.
Zofran.
Yeah.
Oh, all right. This was a good question. I like this. Taking it back to the moles and the skin.
Yeah.
Yeah.
Ladies. Okay, someone wrote, I get more moles with more UV exposure. Will this be similar, producing more moles or freckles, or just darkening existing ones? So I guess they're comparing it to going out in the sun. They get more moles. Will this do something similar? Will it make the moles darker or produce even more moles or freckles?
So it won't make you produce freckles. The thing is, you may have freckles there that are there that you just don't see because you're not melanated. So it's not going to produce new freckles, and UV exposure won't. It's just exposing the one that you already have. So like for me, when I used it, I didn't see a lot of the moles. They were there, but until I got darker and got more melanated, my melanin went up, then I could see them. So it wasn't that they were never there, and all of a sudden by taking MT2, it gave me more. It just kind of exposed the ones that were not visible because of my skin tone. And so it's not gonna make you have more moles. It's just gonna expose the ones that you already have and make them darker.
Mm.
So.
Are there any energy benefits from this? We've heard from some people taking it that they feel very
Yes.
like motivated and
Yes.
energized.
Yeah, so like we were talking about, the melanocortin system overlaps heavily with like dopamine pathways, autonomic nervous system pathways, hypothalamic regulation. So yeah, there's a lot of people that will say they have increased drive, they have increased mood, motivation, and just better exercise tolerance even. So some of that is probably directed at the neurologic signaling. So a lot of and then some of it can be really like secondary to just improve confidence. Like think about how people feel, especially women, right? I can tell my wife she's beautiful till I'm blue in the face, but if she doesn't feel sexy, if she doesn't feel confident, she's just not going to feel confident, right? So a lot of it can come from improved confidence, improved body composition, increased sunlight exposure, or some of the downstream metabolic effects. So yeah, there is a lot of people that have an increased like drive from it and energy. Like they just report that they have more energy, kind of like with GLP-1s and GLP-GIP. So a lot of people will say, "Oh my God, I just feel better," and they're like, "I can't pinpoint it, but I just feel better. I think better. I think clearer." I have so many women that come in and say that, and I think one of the biggest mistakes that's happened with GLP-1s and GIPs is that they put it in this little box and it's for weight loss. And I'm like, it does so many more things. I have so many like cardiologists that I refer to, and they're putting a lot of people on like terzepatide and things like that now, left and right because of the benefits. So a lot of benefits to it.
I want to ask, can you use this if you're taking blood pressure medication?
Yeah. Yeah. So blood pressure itself it's so, how do I want to say this? Poorly treated, misunderstood. I mean, in the US, there's so many things that like they just jump to, and not that I won't. I want to see like a blood pressure log before I just go a one snapshot in time high blood pressure. I'm not going to stick you on a blood pressure med. I want to see unless they come in and they're like a 190 over 110 kind of in a in a flare or something. But for the most part, I want to see a blood pressure log. I want to see it go. And then I want to try things like, are they taking magnesium? Is their potassium level good? Like there's a lot of things to look at. But as far as that is a loaded question, because what is causing their high blood pressure? Will melanotan 2 increase blood pressure? No. Like I have not seen that. In fact, it may lower it because of the vasodilation that happens with it, which is why you get more erections. There's better blood flow. So yeah, I mean, I haven't seen it increase blood pressure. I haven't seen it reported at all. But in fact, I would say the opposite. I would say it's more likely to control. So not a control for blood pressure. I want people to think that at the very least, it's a null effect. Like it's not going to affect it.
Keep seeing messages about scars, about freckles, changing color, keloids. Let's do this one more time.
Mhm.
One more time. Will it darken keloids, scars, facial scars, whatever it may be? One last
No,
time.
no. So think about it, right? So think about like women that have scars or have cellulite or have things, right? You know, they look better. Even if somebody has, like women have like a little cellulite in the back of their legs or back of their, you get tan and it kind of like masks it. It kind of goes away. It's kind of the same thing with that. And I guess it all depends. Like, what does the scar look like before? Like some of the, or, you know, some of the keloids or some of the scars, they already have a different pigmentation. So it might even it out, or it might make it stand out more. So there's no way to tell. That's not really a question I can answer other than they have to try it and find out. But it's what is the initial, like, is it already a different color on their scar? Where is it? You know, is it facial, which is, you know, more likely to be seen? Is it, you know, back? So it's hard to tell. It can either smooth it out and camouflage it or mask it like it does a lot of other things, or if it's already a different pigmentation and the skin around it is not going to be affected, it may make it show up more. So that one is not an easy one to answer because you'd have to, again, every scar is different. Every person is different. So it's just going to depend what that scar looks like before they start it.
Yeah, I'm just wondering, I have surgery scars and it is darker than my skin, but you're saying that particular skin area might not necessarily darken
Yeah.
because it's just how the scar tissue healed. It's
Mhm.
not, so it won't darken that spot, but all the skin tissue around it will, so it might even out. But for
It
some
depends.
people,
Yeah, it depends where the scar, what the scar looks like. Because if it's already off color, it again, I've seen it even out and camouflage the scar, and I've seen it, you know, make it more prevalent. So there's really no way to tell. It should, you know, it should even out because, you know, your melanin is, it's everywhere. It's not just, again, like I said, it's not just going to make your arms or your legs or, you know, your face darker. The melanin production goes up, you know, system wide.
Can you talk a little bit about people you would think that this is not a good fit for? Things or that are contraindications for it. And we had someone ask about immune system because
Mhm.
melanocortin receptors are in some immune tissues.
Yes. Yeah. So that's a great question. And I would be also like, and that's the beauty of LEMD, right? So understand that that's why I feel comfortable referring people there, because is there, you're gonna get, it's gonna get reviewed by a provider. So it's not, you're not going to some influencer online that's saying buy my stuff. And it's coming from a pharmacy, right? So um it's not like you're going to refer and they're not going to look at their previous history. So like for me, I want people to understand that it's not simply, like I said, it's not a tanning peptide specifically, you know, because it affects a lot of the other systems. But what I want people to consider and what the LEMD providers will look at is personal and family history of skin cancer, right? If they have any autoimmune conditions, medication sensitivities, history of like, do they have history of melanoma or even squamous cell or basal cell carcinoma? That's a no. Like that's an absolute no. Um, you know, and then whether they're working with a knowledgeable provider. So that's the other thing with LEMD is that this isn't like just you're going to go on there, order it, and boom, it's coming to you. It's reviewed, and if you're not a good fit, and there's a contraindication, they're not gonna prescribe it to you. So the biggest thing is family history, or personal history of any kind of like moles. If for if for any reason, if you have a lot of moles, and they're already like, you know, multicolored, if they're already looking suspicious, like not the ideal person to start MT2. You know, obviously, like I would go to a dermatologist first, make sure that they're, but it's going to be mainly family and personal history of skin cancers.
Yeah, thank you for that.
I like this question from C. Nelson. If you stop the product, how long is the lifespan of the color? If you're off 4 weeks, will you return to previous skin tone?
In my experience, yes. Yeah, so and other people know. So it might last 2 weeks, it might last 4 weeks. It's like, how dark did you get? Because
Mhm.
like, think about when you get tan naturally, you'll last a week or without continued sun exposure. I mean, if you continue sun exposure, you'll maintain it. But I think also that harkens back to the genetic variability of each person, right? So, how light were they when they started? How dark did they get when they are? But on average, it's between 2 to 4 weeks.
Mm, that's good to know. Lauren?
I I feel educated, everyone, and there's so much more to learn
Mhm.
about this. But Dr. Villarreal, I'm so happy that you've highlighted like beyond its vanity benefits,
Yeah.
because the claim to fame, right? It's exciting. It's in time for summer and Memorial Day, but this goes beyond just that. And really
Well,
cool.
real quick to touch on, because I know you had a question on immune response.
Mhm.
So just so people know, alpha MSH and melanocortin, signaling, they're known to have anti-inflammatory, immune modulating properties. That's what a lot of the studies on alpha MSH were on that. So a lot of research has suggested that like melanocortin pathways can help regulate like inflammatory cytokines, immune responses. So that would help like inflammatory disease, autoimmune conditions, neuroinflammation, tissue protection. So we're talking about in longevity medicine, chronic inflammation is one of the major drivers of aging and disease progression. So like anything that favorably influences inflammatory signaling naturally gets attention. So, which is, we call it inflammaging, is, inflammation that ages the body. So yeah, it also has a response with lowering inflammation and immune response.
Um, Dr. Aaron Stark asked, can this be stacked with other peptides? Maybe rather than can it be stacked, what peptides should you not stack this with? Maybe we reverse it.
Honestly, I don't know, other than maybe don't stack it with PT141, because you might get that,
Double.
you might get more of the melanotan and more of the melanocortin pathways stimulated. I would, I would say I don't prescribe it concurrently with PT141, because it's either one or the other. And they're gonna, and again, if they failed, and I say failed, there are some non-responders to PT141, or poor responders. MT2 would be good, again, not just for the tanning, but for the sexual benefits. So the only one that I would say not to use it with concurrently would be PT141.
Okay. Well, that's good to know. Janelle wrote, phenomenal job, Dr. V, as
Thank you,
always.
Janelle.
As always. Well, if we don't have any other questions, I feel like this is amazing. You did such a wonderful job explaining this, breaking it down. I feel pretty educated on this. And it's a great peptide to kick off the summer with, the unofficial beginning of the summer, this Memorial Day. But thank you so much, Dr. V, for tuning in and joining us and educating our community. And thank you all for tuning in tonight and being part of this beautiful community. Thank you.
If you were invited by someone tonight, please be sure to reach out and just say a thank you or a little hello. And I hope everyone goes into Memorial Day weekend just feeling the relaxation and the summer vibes.
There you go.
So, any last words, Dr. V?
No, just to understand that the MT2, it's way more complex and fascinating than people realize. So it's not just about the tanning; it's interacting with all.
Uh-oh.
I thought it was
Did
me.
we lose parting wisdom?
I know. Oh, I think he was saying it's a lot more complex and it's not just about vanity and a tan. It goes beyond
There
that.
it goes.
Oh,
I
there
think
we
I
go.
popped back up. I think I popped back up. No, it's just I was just saying for people not to think it's way broader than just the tanning peptide. It hits a lot of other like signals, and if they have questions, if they ever have questions on it specifically, just know that it's being looked at and reviewed by providers.
Agreed. Oh, we lost him again. So just to wrap up, mood, libido, arousal,
Body composition.
body composition, metabolic health, and of course, little tanning. Oh, there you go. You're back.
I don't know why I keep coming out.
I mean, it's hard. I have to entertain
Yeah.
everyone every time.
Yeah,
you
yeah, yeah.
Oh, yes. Well,
So-
thank you so much, Dr. V, and thank you again, everyone, for tuning in tonight. We'll see you next week. Have a wonderful evening. Thank you. Thank you. Thank you.
Thank you.
Thanks for having me. Take care.
All right. Have a good one. Bye-bye.